Hello, I'm Greg Barsness. I'm a consultant in cardiovascular medicine and radiology at Mayo Clinic in Rochester, Minnesota, the United States. Today I'm at the 22nd Annual World Congress of Cardiology, where I spoke about the optimal approach to revascularization in patients with diabetes mellitus. As we all know, diabetes mellitus is an important and growing problem across the world. Already there are over 100 million people in the United States with diabetes or at risk for diabetic effects and poor outcomes. And across the world, it's already estimated that in the next 15 years, there may be 600 million people with diabetes across the world. So this is a tremendous problem with important healthcare implications, both physical and economic. Diabetes itself is related to bad outcome with or without revascularization. But especially in the setting of revascularization, the impact of diabetes is felt acutely, whatever method you choose to revascularize. Diabetes portends a poor prognosis because of adverse vascular effects. There's an increased thrombotic milieu. There is worse vascular function. And patients who present with diabetes have more lesions, they have more diffuse vascular disease, and they have worse systolic and diastolic LV function. So when we consider revascularization, we need to consider multiple components. We need to consider the patient's coronary anatomy. When patients have multivessel disease, they are at increased risk for poor outcome. Their outcome can be improved through surgical approaches with edema and complete revascularization, which is particularly appropriate in the setting of medical therapy that is suboptimal. Most of the time we want optimal medical therapy and a team approach for patients with diabetes so that we can discuss optimal medical strategies and revascularization strategies, which may include PCI in those patients who prefer a non-surgical approach and who have sufficiently approachable anatomy, ideally with the goal of complete revascularization.